All right, welcome back to ABA exam review and the continuation of our RBT practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A child refuses to put on shoes and begins to cry. The parent allows the child to stay barefoot to avoid the tantrum. Over time, the child begins crying every time shoes are mentioned. What behavioral principle best explains this? Let's start with something fairly straightforward. We're looking at a behavioral principle that is explaining the scenario. We know the child does not want to put on shoes, so they begin to cry. What is the result of crying? Well, the parent allows the child to stay barefoot to avoid the tantrum. So, in other words, when child cries, they avoid putting on shoes. So, what happens? Over time, the child begins crying every time shoes are mentioned. Why? Because when they do cry, they get to stay barefoot. So, what is occurring here? Well, we know the child's behavior is increasing, right? They begin crying every time shoes are mentioned. And so we know it's going to be reinforcement because reinforcement increases. Now, what type of reinforcement? Well, when the child cries, they escape putting on shoes. So the demand is removed. And when we remove, that is negative. So what we're looking for is negative reinforcement. It's not punishment because the behavior increased and punishment decreases. And it isn't positive because what was removed was the request or demand to put on shoes. So the behavior principle that best explains this is A, negative reinforcement. A hospital patient often hits the call button repeatedly to request snacks. Staff begin teaching the patient to press the call button only once and wait, and then staff only reinforce that behavior. The new behavior serves the same purpose, but is more appropriate. What is this an example of? The key here is the idea that this new behavior is serving the same purpose, and the purpose of the behavior is what? It's the function, and it's more appropriate. Now, there's an idea in ABA when we are teaching a replacement behavior, we want that behavior to be functionally equivalent because when we remove a behavior, we're taking away a person's ability to meet some purpose, right? If we take a behavior serving a function away, we need to replace that behavior with something else that will serve that function or increase the behavior that's going to still meet that function. So if we're teaching a new behavior that serves the same purpose but is more appropriate for a patient who hits the call button too many times, and now they just want the patient to press the call button once, so the pressing the call button once is going to meet the same purpose as repeatedly. What is this an example of? A, overcorrection. So overcorrection is not necessarily an RBT term, but it is a type of punishment procedure where you are making someone do something over and over again. Overcorrection does not apply. B, escape extinction. Well, no extinction is going on necessarily for escape. The hospital staff is not preventing escape for this patient. That's not the function of the behavior. C, functional communication training. They're not teaching the client to communicate more functionally, right? He's still pressing the call button. So he's still communicating the same way. What they're doing is just reducing how many times he pushes the button. And it's still going to serve the same function. And so they're teaching what we would consider a functionally equivalent behavior. So this is an example of functional equivalence. Kai is collecting data on a client's vocal imitation of words. He sets a timer for 10 seconds. If the client imitates the word within 3 seconds of the Kai's model, Kai marks a plus. If the client takes longer than 3 seconds or doesn't respond, Kai marks a minus. Kai is primarily measuring which dimension of behavior. So we have a measurement question. And first, let's identify what behavior we're looking at. Well, Kai is looking at vocal imitation. His timer is set for 10 seconds. If the client imitates the word within 3 seconds of the model, Kai marks a plus. So Kai's model is the SD, and then Kai wants to see a response within 3 seconds. What dimension is Kai measuring? Well, he's measuring time in between his SD and response, which is going to be what? That is going to be our latency. Remember, time in between the SD and response is latency. What about time in between two responses? If time in between models, let's say, or modeling behavior, that's going to be our inter-response time. And what about the duration of just a singular response? That's duration. So when you lay it out like this, you can see our timing measurements and how they function or how they work. SD to response 1 is latency. The total time of each response is duration. So this is duration 2. And then time in between responses is IRT. Kai is measuring if they respond in time to the SD. So time in between his request and the first response. That is going to be B latency. In a group home, a resident begins pacing rapidly and yelling loudly during lunch service. A staff member trained in behavior support calmly blocks access to the kitchen knives, removes other residents from the area, and initiates a pre-planned safety protocol. What aspect of behavior technician responsibilities does this reflect? So part of our task list and part of what you need to know as a technician is what's your duty, what is your primary responsibility? Like, what are you responsible for, right? In this case, we're looking at the responsibilities of this tech. We have a group home, the resident in the group home is pacing rapidly and yelling loudly. So whenever one of our clients escalates, right, we become alert. And we become alert because we are preparing for possible emergency situations. And in each treatment plan and during training, your supervisor should have trained you on emergency and crisis protocols. In this case, the staff member trained in behavior support blocks access to knives, removes residents, and initiates the pre-planned safety protocol. Our safety emergency crisis protocols are not just spur of the moment things. They're planned for, they're written, and they're trained for. Given all this, what aspect of responsibility is reflected here? A, implementing discrete trial training. The staff member is not implementing DTT. They're responding to what this resident is doing. B, conducting preference assessments. No preference assessment is taking place. C, following emergency protocols. Yes, we have a resident escalating. Staff member follows the safety protocol. They're blocking weapons. They're keeping others safe. They're keeping the learner, or in this case, the resident, safe. They're following these pre-planned emergency protocols. And then D, delivering punishment. No mention of punishment or consequences here. The staff member is just modifying the environment to protect all involved, including themselves and the client. So what the technician is doing is C, following emergency protocols. During a DTT session, a client consistently screams when the technician presents a demand. The behavior analyst has hypothesized that screaming is maintained by escape from demands. The technician has been instructed to calmly represent the demand after each scream until the client complies. This specific procedure primarily involves the use of what? All right, so that was a mouthful, kind of a difficult question to read. That's okay, because we're not jumping to the answer choices, right? We are attacking the question. Now, let's gather some information, right? We're having a DTT session. The client is screaming when a demand is presented. So apparently they're looking to maybe escape. And we learn now that screaming is maintained by escape. The technician has been told to represent the demand after each scream. So is the client allowed to escape? They're not. What the technician is doing is representing the demand. So the reinforcement of escaping, like we talked about earlier, is no longer allowed. It's being withheld. And when we withhold reinforcement, that is extinction procedure. So this specific procedure involves the use of what? A, positive reinforcement for compliance. Well, we're not looking at how the client is rewarded. We're looking at the technician's behavior and what they're doing when the scream occurs. B, extinction for screaming. Yes, technician is withholding reinforcement for that scream. C, negative punishment for screaming. Again, we're not looking at the consequence. We're looking at what the technician is doing when the scream occurs, right? And so when the scream occurs, that demand is reintroduced. And it is not removing or letting the client get away from anything. It's not adding a positive reinforcer, right? It's extinction. And then D, differential reinforcement of other behavior. DRO occurs when we reinforce for the absence of a behavior. We're not reinforcing in the absence of the screen. All we're doing is reintroducing the SD to put that behavior on extinction. Thanks for watching. Check out btexamreview.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you.